Top 3 antioxidants for diabetics to take. Lower blood sugar. Health Aura. Know it right. Live it light. Did you know that something as simple as the right antioxidant could actually help you manage your diabetes better? Sounds too good to be true, right? But it's not. If you're living with diabetes, your body is constantly battling oxidative stress, a silent troublemaker that fuels inflammation, damages your nerves, and speeds up complications in your heart, kidneys, and eyes. The good news? Certain antioxidants don't just fight this stress, they go even further. Some can actually improve insulin sensitivity and even help relieve symptoms like neuropathy. But here's the catch. Not all antioxidants are created equal. So, which ones actually work? Which ones have real science behind them? And which are just hype? In this video, we're breaking down the top 3 most powerful antioxidants for diabetics, and how they can make a real difference in your health. Let's get into it. 1. Glutathione, the golden secret, to help diabetics control complications and improve overall health. Glutathione is one of the most important antioxidants in the body but is rarely mentioned, especially for people with diabetes, who are already severely affected by oxidative stress. In fact, people with diabetes often have 20 to 40% lower glutathione levels in their blood, even ranging from 29 to 36% depending on the severity of the disease. The reason is because high blood sugar promotes the loss of glutathione faster than normal, making it difficult for cells to recover and detoxify, thereby leading to a series of complications such as nerve damage, kidney failure, cardiovascular disease, and accelerated aging. Diabetes is not the only thing that depletes glutathione. Age, poisoning, chronic infections, and even some medications also contribute to reducing this substance's reserves. It is worth noting that the signs of glutathione deficiency do not come clearly but occur silently. At first, you may only feel tired, have a lack of concentration and lack of energy for a long time. But as glutathione levels continue to decrease, serious problems begin to appear: pain, numbness in the limbs, especially if you have diabetic neuropathy, anxiety, depression due to neurotransmitter imbalance and inflammation in the brain. Even losing weight becomes difficult because impaired mitochondrial function slows down metabolism. Glutathione also has a major impact on fertility, something that few people pay attention to. A deficiency of this substance leads to high oxidative stress, which damages the quality of sperm and eggs, thereby reducing the ability to conceive. Hormonal imbalance also leads to a decrease in sexual desire. Regarding kidney function, one of the most vulnerable organs in people with diabetes, low glutathione makes the damage process happen faster. The eyes are no exception. Diabetic retinopathy progresses more rapidly when the body cannot control free radicals. The cardiovascular system is severely affected when there is not enough glutathione to protect blood vessels, increasing blood pressure, hardening of the arteries, and increasing the risk of stroke and heart attack. Poor blood circulation, slow wound healing, and overall health decline all stem from a deficiency of this antioxidant. At the cellular level, glutathione is the silent hero, whose job is to neutralize free radicals, the ones that damage DNA, proteins, and fats. In diabetes, where glucose metabolism generates more free radicals than normal, glutathione deficiency worsens insulin resistance and causes more damage to pancreatic beta cells. As a result, blood sugar control becomes more difficult and inflammation increases. Some people even have genetic factors that make the ability to synthesize glutathione lower, further complicating the situation. The good news is that we can increase our natural glutathione with a sulfur-rich diet: beef liver, especially Wagyu beef liver, garlic, eggs, spinach, asparagus, avocado, and okra. However, it should be noted that glutathione is easily destroyed when cooked at high temperatures, so it should be eaten raw or lightly processed to preserve nutrients. Combining foods rich in vitamin C such as oranges, pineapples, and guava will help recycle glutathione more effectively. If your diet is not enough, you can supplement with functional foods such as NAC, N-acetylcysteine, a direct precursor that helps the body produce glutathione. The recommended dose ranges from 600 to 1.800 mg per day. Another option is glutathione, a patented form of glutathione with high absorption, with a dose of 250 to 500 mg per day. At the same time, it is necessary to avoid foods that deplete glutathione, such as fried foods, fast foods, refined sugar, alcohol, refined oils and processed meats, the culprits that cause the strongest oxidative stress. The effective solution is to return to natural, whole foods, limit chemicals, combine nutrition and scientific supplementation to protect glutathione levels, the key factor to help diabetics become healthier every day. 2. Vitamin E, the silent guardian for diabetics. Vitamin E is more than just a supplement, it's a potent, life-enhancing antioxidant, and for individuals with diabetes, it can be the difference between thriving and merely surviving. Yet, many diabetics suffer from silent deficiencies. Why? Because elevated blood sugar levels trigger relentless oxidative stress, rapidly depleting the body's reserves of vitamin E as glucose levels rise. So does the body's desperate need for this powerful protector. But the challenges don't stop there. Insulin resistance, a hallmark of diabetes, interferes with the body's ability to absorb fat-soluble vitamins like vitamin E. Chronic inflammation, another constant companion in diabetes, burns through antioxidant defenses even faster, leaving the body more vulnerable than ever. Diets rich in processed foods and poor in healthy fats only worsen the issue, further reducing vitamin E absorption. To make matters worse, medications like statins and some diabetes drugs may impair vitamin E metabolism, quietly accelerating deficiency. The signs are subtle at first: mood shifts, creeping anxiety, and low energy, but they grow. Vitamin E plays a vital role in protecting brain cells from oxidative stress. Without it, neurotransmitters falter, brain inflammation escalates, and emotional balance slips away. Anxiety, depression, and mood swings may become frequent visitors. Metabolic health also suffers. Low levels of vitamin E reduce mitochondrial efficiency and impair fat metabolism, making weight loss feel like an uphill battle. In fact, research shows a strong correlation between low vitamin E and higher body mass index, particularly abdominal fat. Fertility takes a hit too. In men, vitamin E is essential for sperm health, motility, and DNA protection. Without it, oxidative damage weakens sperm and reduces fertility. In women, deficiency affects egg quality and disrupts hormonal balance, making conception more difficult. Libido may decline as well. Vitamin E fuels blood circulation and hormone production, both critical for a healthy sex drive. Nerve damage, or diabetic neuropathy, is another serious risk. Vitamin E shields the myelin sheath, the protective layer around nerves, from oxidative destruction. Low levels mean nerves are more prone to injury and slower to heal, resulting in numbness, tingling, and chronic pain. The kidneys, vital and vulnerable, also rely on vitamin E to reduce oxidative stress. Studies show that diabetics with higher vitamin E intake have up to a 30% lower risk of chronic kidney disease. The eyes, too, depend on vitamin E. It protects the retina from damage and helps prevent diabetic retinopathy, cataracts, and macular degeneration. At the cellular level, vitamin E defends against advanced glycation end products, AGEs, harmful compounds that accumulate in diabetes and drive further damage. By protecting cell membranes and enhancing mitochondrial function, vitamin E improves insulin sensitivity and may lower fasting glucose levels by up to 10%. Top food sources include sunflower seeds, almonds, hazelnuts, avocados, and wild-caught salmon. For luxury, antioxidant-rich meals, try black truffle almond butter with roasted hazelnuts, wild salmon with avocado lime sauce, or saffron-crusted lamb chops with sunflower seeds. To maximize absorption, pair these foods with healthy fats like olive oil or nuts, and avoid high-heat cooking, which can destroy up to 30% of vitamin E content. If supplementation is needed, opt for D-alpha tocopherol, the most bioavailable form. Trusted brands include Solgar and Now Foods, typically dosed between 200 to 800 IU per day. Avoid refined oils, excess sugar, and alcohol, as they accelerate oxidative damage and burn through your vitamin E reserves. When managed wisely, vitamin E becomes a quiet but powerful ally, guarding your nerves, heart, brain, and beyond, one cell at a time. 3. The power of vitamin C in diabetes care. Imagine your body as a symphony of cellular activity, every heartbeat, breath, and movement powered by invisible forces working in harmony. But for millions living with diabetes, this symphony is under siege. A silent battle rages beneath the surface, one between the life-giving vitality of antioxidants and the destructive chaos of oxidative stress. And at the center of this battle lies one unassuming yet essential ally: vitamin C. Far more than just a cold-fighting vitamin, vitamin C is a biochemical guardian, an antioxidant that defends every cell, every nerve, and every organ from the wear and tear of modern life. Yet, for diabetics, this powerful protector is often in short supply. Why? Because glucose and vitamin C use the same transport mechanisms to enter your cells. When blood sugar runs high, it essentially hijacks the pathways, leaving vitamin C locked out, unable to perform its vital functions. The result? Intracellular vitamin C levels drop by 20 to 40%, a deficiency that's invisible but deeply impactful. Now picture this: your body under stress, inflammation surging, free radicals attack healthy tissues, and your natural defenses slowly eroding. Every ounce of vitamin C is called into action to fight this oxidative storm. But what happens when there isn't enough? Systems begin to fail silently. Mood shifts, energy wanes, nerve endings lose their sensitivity, organs begin to show the wear, all because one crucial nutrient is missing from the equation. And this isn't just theoretical. Clinical research shows that diabetics with low vitamin C levels face significantly higher risks of complications, everything from neuropathy and kidney decline to depression, impairment, and vision loss. This isn't about simply adding a supplement. This is about restoring biochemical balance at a cellular level. When vitamin C levels are replenished, insulin sensitivity can improve by up to 30%, and A1C levels can drop significantly. That's not magic, it's the power of nutritional biochemistry at work. So, as you read this, know that your health is not just determined by blood sugar alone. It's shaped by what supports your cells, shields your tissues, and energizes your life from within. And perhaps, it begins with something as simple, and as anticipated, as ensuring your body has enough of this metabolic nutrient. Now, let's explore why vitamin C is more than a supplement. It's a key to unlocking resilience, balance, and vitality, especially in the face of diabetes. Thank you for joining us in exploring 3 powerful antioxidants that can help manage diabetes effectively. From glutathione to vitamin E to vitamin C, each one plays an important role in protecting the body from free radical damage and improving overall health. Remember, your health is not only about your blood sugar levels, but also about what you feed your body every day. So, are you ready to try applying this knowledge to your diet? Share your thoughts in the comments and let us know if you would be willing to try adding these antioxidants to your daily life. If you found this video helpful, don't forget to like and subscribe for more helpful information. Together, let's build a healthy, knowledgeable community and support each other on your health journey.